Good morning, everyone. How's your morning today? So, the weekend has started, right? It's a Saturday morning and we are ready with some MCQs because morning में start होते ही अगर MCQ से start करेंगे तो the day goes very well because morning में theory नहीं पढ़ी जाती. You are still sleepy, आपने चाय ली, आपने दूध लिया and now you want to sit and study. तो सबसे पहले अगर हम MCQs करते हैं तो हमारा दिमाग थोड़ा सा यूज़ होना शुरू होता है, ठीक है? So that's me, Dr. Sonal Parihar. Let me just check the live chat. Yes, so that's me, Dr. Sonal Parihar, on Unacademy, and I will be teaching you Obs and Gynae. So basically, we are doing a crash course for you because हमारे लिए आपका exam pass होना अच्छे नंबरों से बहुत ज़रूरी है, right? So you have NEET PG exam coming on the 21st of May, and FMG also coming this year. Okay, so we have all these batches ready. So that's me. I am a consultant gynecologist and director of my own private hospital, multi-speciality hospital in Jodhpur. I'm an endoscopic surgeon, trained colposcopist, infertility expert, and a YouTuber with more than 1 million followers on Ask Your Gynecologist. And the second channel that I have is Dr. Sonal's Tutorials. डॉक्टर सोनल्स ट्यूटोरियल्स में मैं कुछ ना कुछ वीडियोस डालती रहती हूँ विच आर लाइक इंफॉर्मेटिव वीडियोस, कुछ क्लिनिकल वीडियोस, कुछ एनाटॉमी रिलेटेड वीडियोस, एंड नाउ आई एम प्लानिंग टू मेक अ वीडियो ऑन GT PAL system, GPAL system. Okay, so GTPAL system, इस पे हम बहुत जल्दी वीडियो बनाने वाले हैं, right? So that is the subscription that I keep telling you. Plus subscription is for when you want to access all the 19 subjects from all the 19 tutors of Unacademy. You get everything, all the top tutors. They give you their PDFs, their MCQs, their quizzes. Everything is available. And to get 10% discount, you have to use my code. So that is Dr. Sonal. You get 10% discount by using this code. Next subscription is Iconic में आपको you get pre-paddler and Unacademy both. Okay, so you need time to study that. For pre-paddler you don't have to go separately for pre-paddler. In this subscription both are available and you can get access to all the tutors, all the PDF notes, their lectures, their quizzes, their grand MCQs and everything. Okay, and you can access Unacademy app and these lectures on any phone, any kind of tablet or laptop. Okay, now coming to the previous 3-year question bank that has been released, and that is covering NEET PG, INI-CT and FMGE. So that is available, children. You can buy it. 2 months, 1.5 months subscriptions are available and you can just avail this opportunity. This is a very good option for people who have already studied a lot, and students, you don't want any more PDF notes, you don't want any new theory, you just want more MCQs because you're done with your MCQs and you want more practice. So you can just go for this particular subscription. You get all the 19 subjects, subject-wise test series, system-wise test series, full-length mock test papers, previous year's questions, test series curated by the top educators. Okay, so that is a very good option and light because it is very, very cheap. You can just call on the helpline number 85 85 85 85 85. That's the helpline number. Just ask them how to get this subscription and use my code Dr. Sonal to get 10% discount. Okay, so that is it. Then coming to MBBS Prof 1 for the little doctors who are struggling to study anatomy, biochem and physiology. We are here to help you and you can just call on the helpline number how to get a subscription for that. Doubt clarification series has started from the 6th of April. So we are doing plus classes. These are paid classes. Okay, plus classes are paid classes. How to avail them? You have to call on the helpline number. You have to take a subscription of at least 1.5 months, 2 months, or maybe 6 months, 1 year, depending when is your exam. And then you can avail this opportunity to interact with your tutors in all the subjects. Congratulations to the toppers, and hopefully the children who are following Unacademy, I hope your picture will also be there someday. Okay, so all the best to you. Now these are the special free classes that we do in the evening. Today I have 2 classes, one at 5:30 and the other one at 7 p.m. So they are 1-hour classes and these are very interactive classes. We do polling sessions for MCQs. You can raise a hand and talk to me in audio, and of course you get notes, PDFs as well if you subscribe for it. Okay. Then coming to this marathon 1.5 months batch, 1.5 months because it started from the 30th of March and it's going to finish on the 15th of May, and that is a crash course. We are giving you a crash course on all the 19 subjects, and that is very, very important for you to avail because this is the time, and Unacademy will help you with the crash course. Okay, so we are the best when it comes to crash course. You can have all your top tutors in all the 19 subjects. Okay, so go and purchase it and use my code Dr. Sonal to get the 10% discount. FMGE also, you can just avail this opportunity, get a 2-month subscription That is very, very cheap, just 2 months, and you get all your tutors here teaching you all the subjects with their grand tests and crash courses. Okay, so this has started from the 30th of March. Whatever you have missed, you can avail it, because once you pay, you get everything that has been missed, and this will carry on till the 30th of May. So coming to the MCQs, let me see. Yeah, 10 people are watching me. So guys, come on, start answering. You have to write the question number. So that's question number 1. Write the question number 1 and then write the answer. Okay. So this is a half an hour session. We have finished 5 minutes and we have 25 minutes. Let's see how many questions we can do. All right. Hello Akshay, good morning. It's very nice to see you every time participating. Kalpana Lodhi, according to you, it is A. Okay, anyone else? Let's have some more answers. 10 people are watching. Akshay A, Dr. Pankaj A. That's very good. Okay, so that's 32 to 34 weeks, and that is something you just have to mug up. There is no rocket science behind it, why it happens. Okay. The bone doctor, no, it's not C, it is A. Okay. Can you please write the number of the question? So it's 32 to 34 weeks. That is the maximum time of amniotic fluid. So question number 2, golden color appears because of what? RH incompatibility, fetal death, IUGR, or fetal distress. And can you tell me why? Okay, Akshay has answered 1. That is A. I have 1 answer right now. So let us have more answers. Kalpana Lodhi A. Why does it happen, children? Can somebody write down? Why does it become golden? Okay, everybody's answering A. Okay, that is because of the breakdown of the RBCs and release of bilirubin there. Okay, the major contribution of amniotic fluid after 20 weeks of gestation is what? Question number 3. So what is the major contribution? Yes, lysis of RBCs. Yes, Akshay. Okay, the major contribution of amniotic fluid after 20 weeks of gestation is what? Yes, Kalpana, you are right. More RBC destruction because of RH incompatibility. IUD will have more of a brownish, dirty color, kind of dark brown color amniotic fluid. Pragya Kumari, question number 3B. Yes. Right, so it is urine. After 20 weeks, the fetus skin gets keratinized, and we know that the whatever fluid was coming from the osmosis of the fetal skin does not happen after 20 weeks. So after 20 is the fetal urine mainly. Not a function of amniotic fluid. That's question number 4. Not a function of amniotic fluid, maintaining temperature, reducing trauma to the fetus, providing nutrition in the form of fat and protein, preventing ascending infection to the uterine cavity during labor. Question number 4. Okay, so we have mixed answers D, C, D, C. Right. So the answer is providing nutrition. Amniotic fluid never provides nutrition to the fetus. It is maintaining a cushion around the fetus so that it protects the fetus from trauma. It maintains temperature, yes, and it prevents ascending infection to the uterine cavity. That is why whenever the membranes are ruptured, we give the patient some antibiotics, because now the fetus is exposed to the external world. So the amniotic cavity, the fluid, is basically protecting the fetus from the outer environment. Moreover, when it flushes, when the amniotic fluid gets released, it flushes the entire birth canal with its alkaline fluid, and that kind of gets rid of the ascending infections. Okay, so it is C. It does not provide any nutrition. Question number 5. Keratinization of fetal skin occurs at? So that's simple because I just gave you the answer. Question number 5. Okay, Avinash, you are saying D. then A, then A. So these are mixed answers. Remember, I told you the keratinization happens after 20 weeks. So after that, the contribution of amniotic fluid does not come from the skin. It is mainly urine. So what do you think will be the answer after 20 weeks? That's a hint. 16 to 18 will not go. Okay. What about the rest? Okay, nobody's answering C. Answer is C. It is after 20 weeks when it happens. Okay, so the closest answer here will be 24 to 26 weeks. Here it is written 18 to 20 weeks, which does not happen so early. 18 weeks में इतने जल्दी keratinization नहीं होता है. Okay, it's after 20 weeks. Right? Question number 6. Percentage of water in liquor amnia. How much percentage of water is there in the liquor amniae? Question number 6. Okay. Okay, we have Kalpana, where is F? What are you writing? Is that a misprint? So we have two answers, C, C, D. Anyone else? So the right answer is D. Okay, it is D actually. It is 99% is water. Okay, so 99% of the liquor amniae is water. Rest of it is some protein, some desquamated cells from the fetus, the vernix and all that. Okay, so we will read this chapter today in the evening between 7 to 8. Whatever will be left will be carried on maybe on the 11th. Okay, so it's a big chapter because we'll be covering placenta, the normal placental structure, the umbilical cord, the abnormalities of placenta and umbilical cord, and the amniotic fluid and the abnormalities of amniotic fluid. So it is like two chapters combined together, 3 chapters. So we'll do some part of it today, part of it on Monday. All right. Now, question number 7. True about amniotic fluid. It's a PGI question, guys, so you can have multiple choice questions. It is not just one answer. Good morning, Napoleon. Yes, Kalpana, I know it was a typing error. Okay, true about amniotic fluid. Same concentration of plasma throughout pregnancy, forms from transudation of plasma through the fetal skin before 20 weeks of gestation. Fetus swallows amniotic fluid, protects fetus from injury, main channel for gaseous exchange. So which of them are true? More than one answers are true. Tell me. Question number 7 and then you write down the options. Okay. Good, we have many answers which are right. So it is B, C and D. Kalpana right and Avinash, you are also right. Yes, and Pragya, you are also right. So some people have missed B. So I just told you that before 20 weeks, before 22, 24 weeks, when the fetal skin is not keratinized, there is transudation of the fetal plasma, and that is the skin transfer of fluid which can reflect in the amniotic fluid. After 20, 22 weeks, once the skin is keratinized, the main contribution of amniotic fluid is the fetal urine. Okay, same concentration of plasma throughout pregnancy is not possible. Obviously, when the fetus is growing, urine is coming out and it is swallowing also, so it will have many other things which are not present in maternal plasma. Okay, so point number A is wrong. Point number E, obviously main channel for gaseous exchange, no, it is the umbilical vein and the artery which are carrying the oxygenated and the deoxygenated blood. Okay. Yes, Sony. So you were probably confused. So just that is why we do so many MCQs, right? Amniotic fluid is mainly produced by placenta, fetus, chorion, or amnion. Very simple question. Just one answer. Question number 8, please. Akshay, you can just write your answer once. You don't have to repeat it like 5 times. Okay, so everybody is saying B. Yes, that is fetus. The main contribution of amniotic fluid comes from the fetus. pH of amniotic fluid is what? Question number 9. What is the pH? This you have to remember. You just have to mug it up because you can see all of them are kind of alkaline pH. Okay, so we know pH is alkaline, but what is the exact pH? They're very close. Okay, we have one answer, Avinash. Combat healer. Can you please write the number of the question, combat healer? So it's 9BCBC. I told you they're very, very close, so you will get confused. So you just have to mug it up. Okay, so it is B. It is 7.1 to 7.3, and I think just two people answered it correctly. In fact, just one. In fact, Avinash, you answered it correctly, and Sony also. Okay, so it is B. It is 7.1 to 7.3. It is not 7.4. Okay, so you just have to remember this. Now, question number 10. Surfactant appears in the amniotic fluid at the gestational age of. You know, surfactant is very, very important for the lungs to expand later. The alveoli have to expand, and because of deficiency of surfactant in a preterm baby, sometimes they need surfactant injections directly in the lungs once they are born. Okay, so that is a hint. So when will it appear in the amniotic fluid? When will the fetus start producing it? Tell me. 10. Okay, so we have D, we have A, maximum are D. Somebody is saying after 34 weeks. No, it is actually D. That is why the viability, the fetal viability. Do you know what is the difference between the viability of a fetus and the preterm and the full term? So 37 weeks is technically full term. Okay. So before 37 weeks is preterm. But at 28 weeks, the fetus is said to be viable. In our country, the viability period is the 28 weeks. That is why whenever we do the GPAL system, the GTPAL system, I'll be making a video on this. G is gravida, how many times she has been pregnant, and if she's pregnant right now, then it will be added to that number. Okay. PAL, P comes for the viable fetus delivery. So viable means after 28 weeks. So any patient who gives you a history of delivering 3 children after 28 weeks, whether they are live or not live, they will come in this parity. So if it is 3, it will be 3. Okay. So that is why 28 weeks is the viability period in our country. But when it comes to US, it is 24 weeks. According to WHO, if it is more than 500 grams, then it is not an abortus, it is a viable fetus. Okay, so that is because their technology, their science is much better, the facilities are much better, and I have worked in UK for 3 years. So I have seen that in fact 4 years I was working in NHS for 4 years, and I could see even fetuses of 500-600 grams, they were saved by injecting surfactant and very good NICU facilities. Okay, so 28 weeks is the time when the surfactant appears in the amniotic fluid. Yes, combat, you're right. So 500 grams, 28 weeks. WHO is 24 weeks. Very good. Okay. Avinash, you're saying appears at 20 weeks, but maximum activity at 32 weeks. All right. Question number 11. The amniotic fluid isn't. You people are studying very well. So many things I come to know from you, right? So thank you very much for enlightening my knowledge as well. Because it's been 30 years since I studied all this. Now, the amniotic fluid is in balance by, it's a PGI question, guys, and there will be more than one answer. So 11, and then you write the answer. Sony, you have to consider 28 weeks as the viability period because you are giving an Indian exam. So in India, it is 28 weeks. So 28 weeks and above is a delivery, and that comes in the P category, not A. It is not an abortus, it is P, parity. Okay. Amniotic fluid is in balance by excretion by fetal kidneys, maternal hemostasis, fetal intestinal absorption, fetal membrane absorption, and fetal sweating. So more than one answer. Kalpana, it is a PGI question, be careful. It's a multiple choice question. I don't know in the INI-CT what is a pattern. You people might be knowing better. Will it be like multiple choice, more than one answers, or but what I can see in the previous year questions, the PGI always has more than one options. Okay, so 11AC, 11AE, 11ADE, AD. What is Napoleon? What is TTT? What is TTT? Don't play here. Shreya ACE, Kalpana ACE. MDS आपको इंग्लिश नहीं आती है तो आप हिंदी में जवाब दीजिए, आपको इसको पढ़ना ही तो है, इसको पढ़ के जवाब दो। 11 नंबर क्वेश्चन लिखो और आगे ऑप्शंस लिखो। ACDE Kalpana. Okay, so let me tell you, all these answers are correct. Okay, so it is in equilibrium with intestinal absorption, fetal membrane absorption, fetal sweating. I don't know why sweating is also added here, but that is also something that is a surprise to me. But this is what the book says, that even the fetus can sweat also, because the skin is now breathing and within the amniotic fluid, and its skin is also excreting all the waste material. Excretion by fetal kidney, yes, and maternal hemostasis. So all the options are correct. Okay. Question number 12. Oligohydramnios will be seen where? In which condition? So it's not letting me write. So question number 12. Okay. Renal agenesis, esophageal atresia, exomphalos, and neural tube defect. Okay, Napoleon, please be a bit more specific. So question number 12. Oligohydramnios will be seen in which condition? So we have A, B, A. You're right, renal agenesis. In esophageal atresia, what will happen? If the esophagus is not formed properly, or if there is a fistula between the esophagus and the trachea, that is TOF, tracheo-esophageal fistula. Sometimes this can also happen. The fetus is not able to swallow. So when it will not swallow, the amniotic fluid will increase rather than decrease. Oligo means there is a decrease in fluid. So it is only renal agenesis, okay? Exomphalos will have more fluid because the exposure of the intestines, so it will be more of like exudation from the intestinal epithelium. So it will be polyhydramnios. Esophageal atresia will also be polyhydramnios. Neural tube defects because the meninges are open and there will be transudation of fluid from there. So all the other three conditions are basically leading to polyhydramnios. Oligo is only because of renal agenesis. Alright? Yes, Tapendra, you are right. It will be poly in entity. Now, question number 13. Oligohydramnios is or are associated with? Again, the same question in a different way. So, that's a PGI question, guys. Don't get confused that if it's a PGI question, it has to be more than one answer. It can sometimes be just single answer. Akshay. Okay, we have already finished... we've already finished 12th and it was only A. It's question number 13. 13, you are saying B, C, B, 13, B, C, B, C. Okay. So it is actually only B. Post-mature birth, I don't think that is... Oh yes, yeah, post-mature birth is also the right answer here. That is because, why? Because the liquor is less. So basically the pressure on the amniotic fluid and on the amniotic membranes and on the cervical dilatation will be less. So it will lead to post-mature birth. Okay. Premature birth happens in what? In poly. Premature birth will happen in poly, and neural tube defect will also lead to polyhydramnios. Alright. So that's good, guys. Very good. Very nice. Then question number 14. Renal agenesis is associated with... Same question asked in a different way. Renal agenesis is associated with... MDS, you want to speak English like me, then you will have to be in an English medium school, and once you start speaking, you need to practice, okay? Okay. So it's oligo and what else? Anybody else? Yes, it is D. So renal agenesis will be associated with not hydramnios. Hydramnios means polyhydramnios. It will be oligohydramnios, okay? And TOF will be related to polyhydramnios. Which of the following conditions is associated with polyhydramnios? Now, that's a different question. Question number 15. Posterior urethral valve, cleft palate, congenital diaphragmatic hernia, and bladder exostrophy. Okay, so it's question number 15, please. Question number 15. Yes, Avinash, my Telegram group is in the name of Dr. Sonal Parihar. Dr. Sonal Parihar, NEET PG / FMGE. So you can easily find it. Because initially I named it as NEET PG, but that is very confusing. You can see my DP there, my photograph, and it is starting with my name, Dr. Sonal Parihar. Okay. Okay, so it's 15. You're saying B. The 15 answer is which of the following? Yes, it is polyhydramnios. Do you know what is posterior urethral valve? Posterior urethral valve happens in male fetuses when there is obstruction to the urine outflow. So if there is obstruction, that needs surgery later on once they are born, and that will lead to oligohydramnios. Congenital diaphragmatic hernia will definitely lead to less swallowing, and less swallowing means they will be yes, less swallowing can also lead to polyhydramnios, right? Which of the following conditions is associated with polyhydramnios? Bladder exostrophy. I feel that probably these three are right. Question number, if I check 9. Okay. Let me check with the theory class today in the evening. Congenital diaphragmatic hernia, it will hamper the swallowing, right? So it should lead to polyhydramnios. I think that is one of the causes. Bladder exostrophy may lead to, I think it should be B, C, D. Apart from A, it should be B, C, D. It should have been except. If it has been except, then it should be just posterior urethral wall. The answer should be 1, A, isn't it? I feel that all these three are right. But in your book from where I've taken the MCQ, it is just saying B. Let me check. Can you guys please check and let me know today in the evening special class at 7 p.m. Can you please check this and let me know? Because I will also have to go and check in the theory class, because I think these are all the three possibilities mentioned in polyhydramnios: cleft palate, congenital diaphragmatic hernia, and bladder exostrophy. Let me check, okay? Single best is cleft. Yes, single best is right if it is just a single answer. But I still need to check why not congenital diaphragmatic hernia. Then, a pregnant woman is found to have excess accumulation of amniotic fluid. So that's question number 16. Okay. So, excessive accumulation of amniotic fluid, such polyhydramnios is likely to be associated with all of the following conditions except. Okay. So that is except. Okay. So why is this pregnant woman having so much polyhydramnios? What can be the condition? What cannot be the condition? She may be twinning, she may be having microencephaly, esophageal atresia, and bilateral renal agenesis. Simple question. Dr. Shri, yes, I think BCD should be the right answer. 16D, that's a very, very simple question, right? So microencephaly, esophageal atresia, all will hamper microencephaly might be having the spina bifida problem. Twinning, we know it can lead to polyhydramnios, and esophageal atresia because it does not let the fetus to swallow, okay? Question number 17, now causes of polyhydramnios include what? Question number 17. Kalpana, why are you answering A? Twinning will lead to polyhydramnios, right? Now we're coming to question number 17, please. Causes of polyhydramnios will include. So that's a PGI question. More than one options can be there. Very simple question actually. 17. A, C and E. Very simple. Preeclampsia will lead to less fluid because it is leading to oligohydramnios, IUGR because there is defective implantation of the placenta, defective trophoblast invasion, and we know that, and we'll be discussing this in the chapter on PIH. Okay, so there will be increased blood pressure and less volume and less fluid. Okay, renal agenesis, we know it leads to oligo. So it is A, C and E. Simple. Last question, causes of hydramnios. So that's question number 18. What are the causes of hydramnios is same as polyhydramnios. Okay, so let's have this answer and then we finish. A, hydramnios, B and E, and that is right. Renal agenesis will lead to less fluid, that is oligo. Posterior urethral wall, again there will be obstruction, the fetus will not be able to pass urine properly, and that will lead to oligo. Okay, so it's anencephaly because of the open meninges, esophageal atresia because the swallowing is not happening, and twinning because of there is excessive mass of placenta, and twinning is generally in the monochorionic, monoamniotic ones because of TTS syndrome can lead to polyhydramnios. Okay, so that's it. I did not understand what you wrote, combat. DM with poly or macrosomia, I did not understand that. So that's it, guys. Now we will probably do one more question. Okay, we'll do one more question. All are associated with hydramnios except, tell me. All are associated with hydramnios except, that is just the last question, or maybe we can do one more. We can do 20 questions today. All are associated with hydramnios except premature labor, gestational diabetes, renal agenesis, increased amniotic fluid. Except. So that's a very, very simple question, and that is डायबिटीज मेलाइटिस में पॉली होता है क्या मैम? यस, होता है, बिल्कुल होता है. डायबिटीज में इफ इट इज एन अनकंट्रोल्ड डायबिटीज एंड इफ इट इज लीडिंग टू एक्सेसिव पॉलीयूरिया बिकॉज द शुगर इज द मैटरनल शुगर इज हाई, दैट गोज इनटू द fetus and that can lead to polyuria. Okay, so yes, it can lead to hydramnios. So 19, you're saying B, you're saying C. Remember, it is except. All are associated. Premature labor can happen because of excessive fluid accumulating in the uterus. Diabetes can lead to hydramnios. Renal agenesis is the answer because that will lead to oligo, not increased. And the last question today, 20, indication of amnio infusion. You know what is amnio infusion? That is, you are putting the needle inside the uterus and you are just discharging the fluid inside the uterus so that the fetus can have some space to move around. So that is amnio infusion, and we'll be discussing this, how we do it, what should be the temperature. So the indication of amnio infusion is what? That's a PGI question, a hint. Avinash, are you answering question number 20? 20AC. Okay, oligo, yes, that is the indication. Suspected renal anomalies is also an indication because that can lead to oligo. So anything that can lead to oligo, you will need to give an amnio infusion. Okay, so when you give amnio infusion, you can see that probably if the fetal kidney is working well, then the fetal bladder will be full within 20 minutes, because if you are giving fluid inside the amniotic cavity and the fetus is swallowing it, definitely the fetus will swallow. If it swallows it and then it goes into the renal system, the bladder will be full within 20 minutes. Okay, so that rules out any renal problem. But if there is a suspected renal anomaly, then this fetus, in spite of giving so much fluid inside the uterus, will not be able to excrete this in the bladder. Okay, so that is how you differentiate. So oligohydramnios, suspected renal anomalies, and in case of fetal distress, because the fetus, if it does not have that cushion of amniotic fluid around it, it might lead to fetal distress. It might lead to lot many other problems if it comes before 20 weeks. Oligohydramnios before 20 weeks can lead to pulmonary hypoplasia and deformities in the hand and in the legs. The hands might get twisted, the feet might get twisted. Equina varus is very, very common. My husband is an orthopedic surgeon. I see such fetuses coming, such babies coming to him for the plastering and all that. Okay, so that's it, guys. We'll meet you again in the evening. As I told you, I have two classes. At 5:30, we'll be doing the induction of labor and Bishop's core, which was not, which we could not do yesterday because of problem in the internet. And 7 to 8 p.m. we'll be discussing this chapter, placenta and amniotic fluid. Okay, bye bye. Take care. Join my Telegram channel with the name of Dr. Sonal Parihar, NEET and FMG. All right, bye bye.